Health care disparities among African American populations. Throughout this presentation, I will be discussing health care disparities among African Americans, why these disparities exist, and what can be done to eliminate these disparities. To begin with, it is important to understand what health care disparities are. According to the National Institute of Health, health disparities are differences in incidence, prevalence, mortality, and burden of disease and other adverse health conditions that exist among specific population groups in the United States. In 2011, Black non-Hispanics made up 12% of the total U.S. population. In Figure 2, one can see that a majority of African Americans live in the southern states. According to the U.S. Census Bureau, by the year 2060, the population of African Americans will total 77.4 million, accounting for 18.4% of the U.S. population. Because of this, it is important that we attack these disparities now and improve conditions as the population increases and health disparities begin to affect more people. Research studies have shown a growing trend in some of the health characteristics that affect African Americans. It is becoming more and more apparent that these health disparities are affecting this group of people when it comes to life expectancy, infant mortality, obesity rates, and HIV rates. As one can see by the graph provided by the Center for Disease Prevention and Control, Blacks in general have shorter life expectancies than whites. Although the gap in life expectancy between white and Black populations are narrowing, there is still disproportion in the number of years that Blacks live compared to whites. Next, let's take a look at infant mortality rates. From the graph on the left, we can see that African American women have the highest infant mortality rate compared to any other race. Although the exact reasoning behind this statistic is unknown, increased mortality rates may be due to preterm and low birth weight delivery, socioeconomic status, and less prenatal care. When looking at obesity rates across the board, we can see that African Americans' obesity rates are considerably higher than the average U.S. obesity rates. African American women have the highest rate of obesity compared to other women groups in the United States, although 4 out of 5 African American women are overweight or obese. African Americans have the highest rates of hypertension and hypercholesterolemia, and are twice as likely to die from a stroke as Caucasians. African American men also have the highest prevalence of high blood pressure in the world. African Americans have almost twice the risk of diabetes than Caucasians. When it comes to new HIV infections, we can see that both African American males and females have higher HIV rates of infection than their Hispanic and white counterparts. Now that we have discussed the health disparities among African Americans, we must move on to discuss why these health disparities exist within this population. If we understand why these health disparities exist, we will be better able to understand how to improve health outcomes of this population. In the year 2010, over 27% of African Americans were living in poverty. Nearly 1 in 4 African Americans live below the poverty line compared to about 1 in 10 Americans overall. Even when African Americans are not homeless or living in poverty, they often have to deal with poor living conditions. Some characteristics of these poor living conditions may include questionable safety environments, lack of health resources, and non-existent ecological resources for promoting positive health behaviors. People in these communities often have to face challenges with population density, inadequate or unaffordable housing, overcrowding, limited access to resources, and higher crime rates. These conditions can lead to psychological stress, which can have a negative effect on health. Many African Americans today may still experience discrimination in schools and work settings. The unemployment rate for African Americans is 2 times higher than Caucasians. African Americans also have a higher high school dropout rate and a lower chance of graduating from college. Many disparities that affect health also show up with crime. 1 in 3 Black males will go to prison in their lifetime. This often leads to single-parent households, lower household incomes, and increased disparities in African American health care. Murder rates for African Americans are 4 times the national average. It is very possible that the increased obesity and diabetes rates among African Americans is due to poor diet. In fact, there is a higher prevalence of fast food restaurants in African American communities, which could be a contributing factor to healthcare disparities within this group. African Americans are also less likely to have private or employment-based health insurance. They are also more likely to be covered by Medicaid and twice as likely to not be covered at all. Due to lack of transportation, insufficient health insurance, shortage of providers, extensive waiting lists, and inconvenient health service locations, some African Americans may be unwilling to seek health care when needed. In fact, culture and language tend to play a significant role in the perceived satisfaction of health care. According to African Americans, disparities in healthcare access and utilization, patients who share the same race or ethnic background as their provider report higher levels of satisfaction with their care and greater participation in decisions involving their health. Now that we have an understanding of why some of these health disparities may exist, we can move on to discuss what can be done to improve the health outcomes among African Americans. To improve these outcomes, actions will need to be taken, policies will need to be put in place, and system changes will have to occur. Although much improvement has been made over the years, it is still important to continue to work towards less discrimination in schools and workplaces. Also, by reducing cultural barriers, we may be able to improve some of the health disparities of this group. To create healthier communities among African Americans, more grocery stores need to be built in urban areas to encourage healthier eating. People of these communities also need to be educated on the importance of exercise and outdoor activities, healthier eating, and the impact that a higher education can have on health outcomes. The creation of youth programs within African American communities can increase education and would also give children an alternative to destructive behaviors. Young youth development programs need to be created in African American communities. At-risk youth educational programs should also be started in schools and communities. Policies put in place within communities that set permit restrictions on the number of fast food facilities in specified areas would most likely reduce the amount of unhealthy eating that takes place in these communities. More work needs to be done to condemn unsafe housing in poverty areas. Although there is still work to be done, the Affordable Care Act has made progress towards providing health insurance and primary care for all. For example, the Affordable Care Act prohibits insurance companies from denying health insurance to individuals due to pre-existing medical conditions. By looking at the health disparities of this population and understanding why some of these disparities exist, one can begin to work towards the achievement of better health outcomes among African American